Hello, this is Dr. Lorenz, Longevity Health Institute. So, what could be killing us so softly? Well, that's what's going on in the world right now, is this excessive death and mortality rate. Unfortunately, I think some of you have heard of this and hopefully not experienced it, but many people young are dying and dying at rates that are excessive, anything we've seen somewhat in even maybe decades, but definitely since pre-pandemic 2019. And now I call it a killing us softly because, well, it's not really obvious what's going on, and you're also not hearing too much about it. But I am telling you, besides my video that you're going to hear here, and I'm going to educate you on some data and what I think is happening and what I'm hearing happening in our practice and with our practices, or excuse me, our patients' families and loved ones, etc., is that this is real. We have to take it serious, and what you can do to prevent early death. So excessive death rates, this is not an opinion, it's data. It is up. Now, the US collects data very poorly. Our data collection is horrible. We do a lot of things in America great. That we don't do wonderful because they do all this esoteric and washout periods and all this. The UK is a lot better at this, but I'm going to share some different areas, and I'm going to tell you who has the biggest concern about this, and that is the insurance actuaries. And I actually have an actuary patient here that works for an insurance company. We had a small discussion about this. But actuary science is the people that work for the insurance companies that know and can predict death rates. I find it fascinating because there's a lot of analytics and statistics, and they can tell you usually within months, based on some things, when you're going to die. So this matters to them because they're taking your money, investing your money, okay, life insurance, insurance companies, and if you're dying young, they lose. It's gambling and they're losing, and they are freaking out, okay? And it's very real, and in actuary science is very talked about. You can Google this, okay, search it, and I'm telling you, you'll find this, not just here, but all these discussions is in the UK and all over the world. But I want to share with you some numbers, okay? So one of the biggest, most alarming number is one of the databases said that in the US pre-pandemic, since 2019 to current, ages 25 to 45, the death rate had increased from baseline 30%. That's huge, okay? Now, again, we're bad data collectors. I would say our epidemiology could be much better. But let's then reflect on a few other numbers and a few things you can look up. And then I want to make sure I tell you a quote and from a one American insurance company because of what they're thinking and saying. But in the EU alone, so the European Union, anywhere between 9 and 21%, because different countries in the EU, okay, reported in August of 2023, 9 to 21% increased death rate, okay, between 35 and 55. In the US, 35 to 44, there was between a 22 and a 34% increase in 2022, but that was based on working class versus non-working class. That's why there's some variation between 22 and 34%. But still, either class, okay, and whether you're working or not working, this is excessive just in the last number of years. In 2020 to 2022, it was 14 to 19%. We are seeing between ages 20 to 44, okay, still in 2023, we are seeing pre-pandemic excessive deaths, okay? And we're way beyond the pandemic and the last significant variant, so it's not COVID deaths. Directly, I should say. I do want to say that. In April of 2023, it was reported in our World Data, which is a national database, that 104,000 people above baseline had already died in just April, okay? 1 month, okay? So this is very, very significant. There was a 40% increase in the third quarter of 2021, ages 18 to 64. So not just 30%, but 40% when you extrapolate. But basically, we're dying younger, and we're dying at a rate that is still exceeding the pandemic and we are way above baseline from pre-pandemic. So why would this be? Now, again, who has one of the biggest concerns is insurance companies and actuary scientists, okay? One American Insurance says that we're in a crisis, okay, and in some of their literature, because trying to figure this out and figure this data out, what it means. Well, why could this be happening, okay? Now, we know that life expectancy is down worse than it's been in 2 decades. In 2 decades, our life expectancy averaging men and women in the U.S. is 46.4, or excuse me, 76.4 years. That's 76.4 years, but it's down the worst it's been in 2 decades. So why are younger people dying? Why are we dying at faster rates? Well, I'll tell you my thinking and theory, and I don't believe I'm wrong, because the reality is I'm hearing the stories in the practice. I put these stories together with clinical experience here in lab data, and I know what is happening in the body due to the COVID virus and the vaccine, the messenger RNA vaccine. Is a couple things happen, whether you've been vaccinated or not. Vaccines make you worse, but here's what COVID-19 and the spike protein does. It hypercoagulates your blood. It makes your blood thicker. Your fibrinogen goes up. Your von Willebrand factor gets changed. So your blood gets stringy clots. So you are more prone to heart attack, stroke, poor circulation, okay? And essentially, because of the virus, many viruses do that, a systemic inflammatory response. So a systemic immune inflammatory response. That is just COVID, the spike protein, vaccinated or not. That is real. That's happening. We test it in the office here. We see it, and we see it here now even a year or 2 or months after you've either been vaccinated or you've had COVID. So just because you had COVID a year ago does not mean that you're not experiencing some of these spike protein effects, immune effects, inflammatory effects, and hypercoagulability effects. So you have more of a likelihood to clot and to have systemic inflammation, okay? So that's really, really key. Now, the other thing is, and I talked about this in the pandemic in one of my videos, is that we know that the spike protein of COVID also damages organs. And there was 5 organs, but one of them we talked about back in one of those videos I did. Hopefully you watched and enjoyed it. You should be subscribing and sharing this. But is it damaged the organ of the epithelium of your gut lining? And that triggers an immune response, and your body gets pissed. And when it gets pissed and you get a hyperimmune response, you get systemic inflammation. That alone too can cause an inflammatory and hypercoagulability effect. So again, what are we seeing and what's causing a lot of these deaths? And sudden deaths, by the way, because I got some stories I'll share with you. Sudden deaths that are happening in young people because you're getting hypercoagulable and you're getting an immune and inflammatory response. Now, the other thing is that is on literally an epidemic rise is autoimmune disease, okay? Now, roughly between 5 and 10% of the entire world have autoimmune disease, okay? I believe it's around 80 million people in our own country that have an autoimmune disease. That's astronomical, and it's going up. Why would it go up? Well, the spike protein, the virus, as many viruses do, but the COVID spike protein virus damages the organ of our gut lining, damages our thymus, which is an immune regulator, damages our bone marrow, and we get now this autoimmune response because our body is saying, what the hell is going on inside? It can't attack the spike protein, or it tries, but it often overreacts and it auto-attacks us, okay? And autoimmune disease is horrible because when you deal with autoimmune disease, you're dealing with a chronically, essentially imbalanced and inflamed body. Now, we correct and improve most, if not all, autoimmune disease, and sometimes even resolve them. But the point here is a lot of people are dying, a lot of diseases are happening, a lot of them are preventable, but you have to first have the knowledge, and the best of anything comes from the truth. This is the truth. Prevent hypercoagulability. Check yourself for hypercoagulability. Make sure your doctor, whether you're vaccinated or not, and or whether you've had COVID or you think you have or you're not, is drawing fibrinogen levels, D-dimer levels, okay? You're making sure that your vascular system is in check, because most of the excessive deaths, I will share with you, are cardiovascular. Now, are some of them cancer? They are. Our cancer rates are on the rise. In fact, actually, I can't tell you in our practice how many patients came to us and had a story of 3 to 6 months after COVID or potentially after the vaccine, boom, they developed a cancer. Now, the virus itself likely didn't cause the cancer. What happened is it affected the immune system, and the immune system being depleted from the viral hit, the mutated cells went rogue. The cancer cells went rogue. They extrapolated. So 4 become 8, become 16, etc. very fast. Okay? We do know that many viruses, and I think it'll be proved down the road, hopefully sooner than later, that many viruses, including COVID-19, are going to be linked to cancers, directly linked, just like HPV, just like Epstein-Barr, okay? Very, very, very common. So point is, what can we do about this? Well, if they're killing us softly, if I will, okay, meaning these are undetected because why? Well, we don't seek functional help. We don't look at root causes. We essentially kick the can down the road and we band-aid conditions and diseases. Don't accept it. I'm begging you as a caring, passionate practitioner, go to your doctor, go to your provider, okay? Or come here because, here at Longevity Health Institute, we do take new patients. We do the best of what we do with personalized approaches, functional approaches for you, okay, to help you thrive. But part of what we're doing always is understanding what's going on in the world, who's at risk. And yes, even though you're young, you are at risk. Now, a couple quick stories. Just in the last week, I know of stories from patients directly told to my ears of in their 40s, in their early 50s, and even a 36-year-old that had sudden cardiac events. 2 of the 3 passed away, and 1 made it, who's having bypass, who's in his early 50s. Thank God, because he was at a work site and actually his employees did CPR and saved his life, basically, okay? And 2 of the 3 that we know of were vaccinated, but also they had no idea that they were hypercoagulable. And I'm gonna tell you what happens is you only know what you know. Do you know how many, especially men, don't know their blood pressure? Couldn't tell you anything what their inflammatory numbers, like their CRPR. Besides the fact that we're all systemically inflamed from chronic stress, life, right, 2023. So the point being is that these things can be mitigated and balanced and appreciated so that you can get back to living well and you're not at risk, okay? Don't leave your family hanging like this. Don't leave your loved ones, like that, essentially losing their mind and freaking out because of some event happened, okay? That's preventable. This is a preventable condition, but this is not going away. We have to appreciate what has happened in the last few years so we can slow down this death rate, slow down these autoimmune diseases, and improve your health. So I know that this video sounds a little doom and gloom, but I will tell you it's coming from educating you because I hear the stories over and over and over, okay? And every once in a while we catch a patient in here that has a high D-dimer, high fibrinogen. They have a little bit of this hypercoagulability going on. Or when we test them for immune issues, there's a big flip-flop in their immune system, okay? And we don't ignore it. We can't ignore it because that's when diseases present itself, okay? All right. Hope this educates you. Subscribe, share this with others. Let's stop some of these excessive deaths. This is Dr. Lorenz. Be well.